3.3 million Canadians are living with urinary incontinence, the involuntary loss of bladder control. Not only do these Canadians have to manage a host of challenging physical symptoms, but they also have to deal with a lack of awareness surrounding the condition and the stigma attached. The Canadian Continence Foundation has issued a report to address how the current approach to understanding and treating incontinence is failing Canadian patients. Dr. Adrian Wagg, president of the Canadian Continence Foundation, explains.
Urinary incontinence is an incredibly common condition amongst the Canadian population. It's part of the Canadian Continence Foundation's mission to raise awareness of the condition, but also to improve access to services and treatments for incontinence.
Dr. Wagg suggests that equal, unlimited access to therapies across the country is a first step to improving the quality of life for all patients.
Treatment for urinary incontinence is available, but unfortunately, access to services and treatments doesn't reflect the needs of patients today. Of all patients who are prescribed a drug for their incontinence, only 12.5% of them will get a second drug should the first one fail. Now that comes at great cost, both in terms of personal suffering, but also in terms of potential cost to the Canadian economy.
The report reveals that Canada is facing a pending crisis related to the 9.6 million Canadian baby boomers who will require increased support from the health system to treat and manage conditions like OAB and UUI. It's estimated that 30 to 40% of those aged 75 years and older will suffer from UUI. The report suggests that a coherent strategy ensuring access to various treatment options will help reduce the overall cost and individual impact of the condition. Longtime sufferer of OAB, Catherine Barr, highlights how it has affected her life.
My condition affects my daily life very much. I did not understand what was going on with me. I had very embarrassing symptoms, and I was tremendously relieved when the doctor finally diagnosed me. I have to plan every excursion very carefully. If I have to travel on the highway, I have to know every exit. I have to know where every coffee shop is in the event that I may need to use them. My worst nightmare is being stuck on the highway in a traffic jam where I am trapped.
The key to success for patients and their physician is having the ability to juggle treatments around. There is no one-size-fits-all. People respond very differently to different medications. In virtually every clinic, I see patients who are not doing well on their single first-line therapy, and they do require a change in treatment to achieve optimal outcome. Having the ability to customize treatment plans, including access to medications, is clearly extremely important in achieving optimal patient outcomes.
It's time to take a closer look at the escalating incontinence issue in Canada. The report calls for unrestricted access to therapeutic choices for physicians across the country and a complete understanding of the personal and social costs associated with the condition. For more information, visit canadiancontinence.ca.